been building up to this day for some weeks now, and the Department of Health as well, partnering with the IEC to bring COVID-19 vaccines to voters after they've cast their ballots. In fact, 1,000 pop-up vaccination sites have been set up around the country to afford the opportunity to voters who have not yet had the opportunity to get their jab. So with vaccine hesitancy still a problem, the department will pilot an incentive scheme that will see over 60s receiving grocery vouchers for getting their jabs. For more on this, we're joined now by Dr. Lesley Bamford. She is the National Vaccination Team Leader at the Department of Health. Dr. Bamford, once again, thanks very much indeed for joining us at such an incredibly early call time this morning. We appreciate it. So the country's confirmed COVID-19 cases, shall we begin there before we talk about these pop-up sites? Our confirmed cases, this is now since the start of the pandemic. It's now heading for the 3 million mark. These elections are taking place in a strange time between the third and fourth waves of COVID-19. What are some of your biggest concerns today and over the coming days?
Good morning and good morning to the viewers. So as you correctly point out, the third wave is over. We are seeing really relatively small number of COVID cases each day. Of course, we know that this pandemic comes in waves. And we do anticipate that there will be a fourth wave, either later in the year or early next year.
So, I'm sort of wanting to hone in on later this year or next year. So, is that new information that we have now that actually the fourth wave won't necessarily hit us over the festive season this year?
Well, you know, I think we don't know when the next wave will come. And so the estimates are that it will be, as we say, later in the year or possibly early next year. Mm-hmm. Of course, Election Day does pose a risk because we know that many people congregate at our voting stations. Having said that, we know that the IEC has worked very hard to put in place measures to minimize the risk of spread at our voting stations. But it nevertheless does pose a risk, and we will have to wait and see in coming weeks whether we do see a rise in cases as a result of Election Day today.
So the department has outlined it hopes to have vaccinated about 40% of all adults by the middle of November. What's the target as it stands for the rest of the year, so up until the end of December?
Well, our target remains that ideally we had said we would like to vaccinate 70% of adults by the end of December. Mm-hmm. We are seeing less demand than we had anticipated, and that's really why we are working very hard to try and take vaccinations to people, to firstly make sure that they value and understand just how important it is that they get vaccinated, but then secondly to remove any barriers to vaccination. So that's why we approached the IEC, and we were extremely encouraged that they agreed to and have worked so closely with us, because we see Election Day as an opportunity when many people do come out to go and vote. And of course, that's the most important thing that people do today. But we believe that they can both vote and vaccinate, use the opportunity to also vaccinate. And that is why once people are voted at 1,000 voting stations, and we have chosen those voting stations with the most people, and also in areas where our coverage is less than optimal. Mm-hmm. And so we are offering people the opportunity to vaccinate once they've voted, and we hope that as many people as possible will take up that offer.
So, Dr. Bamford,
people who are not voting can also go and vote at the pop-up stations.
Okay.
I mean, so you can also go and vaccinate at the pop-up stations.
Even if you're not voting, yeah. So, Dr. Bamford, the issue of vaccine hesitancy is one that we're still talking about in South Africa. Do you find, in your experience, that taking vaccines to people, so making it more convenient for people to get a vaccine, that plays a major role in our vaccination rate?
So we do believe that. We do have a network of vaccination sites across the whole country, which makes it reasonably easy for people to access vaccinations. But nevertheless, we know that there are barriers. Sometimes people are working during the week and only vaccinate over the weekend. Sometimes even a relatively short journey for someone has costs associated with it that are difficult for that person to make ends meet and have that money to pay for transport.
Yeah. Yeah.
So that is why we, are really encouraging the use of pop-up sites in particular. These pop-up sites can be at malls, they can be at factories, they can be at churches, to really take those vaccines to where people are, to make it as convenient as possible.
Yeah. So the Health Minister last week in that weekly briefing, just giving us an update on South Africa's own COVID-19 fight, talking about incentive schemes, in particular, incentive schemes on election day. So one of those, I know he mentioned something about a food outlet that would also be giving away vouchers to people who get their vaccine on election day. But one of those is over 60s receiving grocery vouchers for getting their jabs. For people who are listening at this time of the morning and who are 60 and over, they haven't had their jab yet, can you tell us more? So how many of these vouchers are available? How do I qualify?
So first of all, just to clarify, the vouchers that have been provided specifically for election day, those vouchers will be made available to our healthcare workers as a reward and a thank you for them working on election day and manning the 1,000 pop-up sites and providing vaccination.
All right.
So that's one side. But more broadly, so we are trying to incentivize and reward people who get vaccinated. As you know, to date, there have been some sports events where fans who are vaccinated have been able to attend.
Yeah.
What we will be piloting during November, working with a number of partners, the partners have put up some funds which will allow us to reward anyone over 60 years who vaccinates with a 100 Rand voucher. And this again is part of the approach of trying to remove barriers to vaccination. So more than 60% of people over 60 years of age have been able to vaccinate. But our research shows that for many people who haven't vaccinated, one of the reasons is that they don't have the resources. So they may not have money for transport. And so really what we're trying to do is provide an incentive which will offset the costs associated with getting vaccinated. And that's why there will be just short of a 250,000 vouchers available. And over 60-year-olds who vaccinate, following vaccination, will by SMS receive a voucher which they will be able to redeem at ShopRite Checkers.
Okay. Dr. Bamford, just a point of clarity, is it over 60s or 60s and over?
So it's 60s and above,
okay,
yes.
Okay.
So remember, there are groups that we're really most anxious to get vaccinated because they are the people who are most vulnerable to developing severe COVID and dying from COVID infection.
Yeah. So we've also opened up a few weeks ago now vaccines to younger people, 12 to 17-year-olds. The uptake, just according to reports, perhaps not as high as we would have maybe anticipated. There are some factors that might play into that. For one, matric pupils are in the middle of writing their final exams. Do you reckon, once the school year has ended, once kids have wrapped up the school year, that will pick up? You're hoping, I'm sure, that it will?
So, yes, we do expect that, as you say, once the school year wraps up, that more young people, adolescents will come forward to be vaccinated. We're very happy with the program because it's run smoothly, and it has provided an opportunity for adolescents to be vaccinated, including those who are writing the trick, those who hadn't turned 18, as well as particularly adolescents who are at high risk of severe COVID infection. So we're pleased to be able to offer vaccination to 12 to 17-year-olds. But as we've said all along, our real primary focus still remains, we're very focused still on the adults, and particularly the older adults, those over 50 years, particularly those over 60 years. So we really count our success in terms of how many of that group who are the most vulnerable we are able to reach.
Dr. Bamford, just a quick one before I let you go. The department also announcing the Sisonke booster study for healthcare workers. I suppose that means South Africans as well who received the Johnson & Johnson COVID-19 vaccine, that in some months to come, depending on when they got the jab, they'd also be eligible for a booster?
Well, the issue of boosters is very complicated, and currently in South Africa we do not provide any boosters. We are looking at the Sisonke 2. It is a phase 3B implementation study where we are using it as an opportunity to study the effect of a booster, to collect evidence. And of course, we are thinking about boosters, and in all likelihood, later in the vaccine program, we will be providing boosters to the overall population. But currently, just to stress that is not our current approach or policy, and the first priority is to make sure that all adults in South Africa first get their standard jabs, whether that's one dose of J&J or 2 doses of Pfizer vaccine.
Yeah. Dr. Lesley Bamford, thank you so much for your time this morning. Such an early morning start on the AM report. She's the National Vaccination Team Leader with the Department of Health as we continue to unpack COVID-19 on voting day. In fact, 1,000 pop-up vaccination sites set up around the country for those voters who have yet to receive their jabs. You can go and vote. You can get your vaccine. The other issue as well is that incentive for people 60 years and above, that 100 Rand grocery voucher. It's available to 250,000 voters or 250,000 vouchers. Once you've received your jab, you'll receive SMS confirmation of that voucher.